I have my student here. Her name is Janae. I'm very proud of Janae. Janae has just been accepted into medical school. She's actually my mentee. So she'll be going to Rowan University, and she was accepted into Michigan State, where I went, but they're starting too early, so she's going to go ahead and enter medical school in August, and she plans on becoming a hematologist, oncologist, and I'm so proud of her. I'm just going to ask Janae some questions because I know there might be students out there who want to go into medicine, who may want to pursue a career in medicine, and I just want to learn more about her story. She has a very interesting story. So congratulations, Janae.
Thank you.
We're so proud of you. My first question for you, did you always know that you wanted to become a doctor?
Yes. I always liked going to my pediatrician's office. I just really liked my doctor. She was really nice. I just felt really comfortable with her. So I had kind of always thought, okay, I'm going to go into pediatrics. I like babies. I like kids. So I was like, okay, I'm going to be a pediatrician. And that kind of transitioned when my brother was diagnosed with leukemia and he had ended up passing away. I didn't really understand what leukemia was. I didn't really understand what was going on. It wasn't until I kind of like entered junior high and I kind of started researching and figuring out what it is that
How old were you when that happened?
I was 10. And I kind of started researching and seeing what it was, and I kind of just thought that would be the better path for me. Yeah.
Good. Very good. So, yeah, I'm sorry to hear about your brother. Sometimes traumatic experiences shape, our future, unfortunately, and I'm sure that had an influence on the type of specialty that you would like to go into,
Yeah,
right?
it did.
Okay, excellent. Excellent in the sense that you're going to be helping other kids, who may have those experiences like your brother.
Yes.
Yeah. Okay. Can you tell me a little bit about your path into medicine? Like, where did you go to undergrad? Were you always a good student? Do you have a master's degree? Just tell me about your pathway into medicine.
I did undergrad straight out of high school. I kind of started preparing myself, trying to figure out how was I going to get to medical school. So very early on in high school, I was like, I'm going to be a doctor. That's what it's going to be. I have to get good grades. I have to take honors classes. So I ended up going to Mount St. Mary's University, which is in Los Angeles, California. So I really liked it. I would say I was a good student. I'd like to say I was very hard on myself. I think because of the reasoning behind what I want to do, I kind of put a lot of pressure on myself. So I think when things kind of got hard, I kind of took it hard on myself. But I was able to pass my classes. I didn't have to repeat classes. And during that time, I joined research, and I kind of found a real passion for that. So I kind of want to integrate that into my practice and what I do. When I graduated, I just knew my GPA wasn't where it needed to be for me to get into medical school. Or at least when I graduated, I thought MD, PhD, that's what I'm doing. That's it. That's what I'm applying for. So I was like, okay, my GPA isn't high enough for that, so I went ahead and did a master's at USC in stem cell biology and regenerative medicine.
Excellent.
And I really liked it because it blended research and medicine, which is really what I was interested in. So being able to be in class and kind of learn the research behind it, and then being able to have physicians come in from different fields with different specialties and kind of say, okay, like these are the problems we face in our field, but the research you guys are doing, this is how it can get integrated, and kind of trying to figure out solutions.
Excellent. Very good. Okay, so, as you venture into medicine, you still want to be engaged in the research side, especially going into hematology, oncology.
Yeah,
it would be awesome to find a cure for a lot of these chronic illnesses, for these children. Okay, now I know you mentioned your GPA. I don't know if you feel comfortable sharing what your GPA was, and in your master's program, did your GPA increase?
It did significantly.
Okay.
So from undergrad, I graduated with a 3.2 overall, and I think a 3.1 science GPA. And then my master's, I graduated with a 3.65.
Excellent.
So it definitely was a big increase for me.
Right.
Yeah.
And my pathway was similar, where I probably told you about doing the post-bac program where I got the 4.0. And so, you have to make sure that you're prepared to matriculate into medical school and that you can graduate. So you definitely did the right thing by pursuing the master's degree. And what about other experiences outside of school that kind of helped to keep your interest in the medical field? Like,
Mm-hmm.
did you do any volunteer work?
Yeah, so during undergrad, I think about my sophomore year, I became a Cope Health Scholar. So it was basically, I would rotate through different units of the hospital. I think each unit you would stay on for about a month. So I think my first unit was the telemetry unit. And it's not so much that you shadow the doctors, it's kind of more so that you're shadowing the nurses a little bit, and you're getting to have patient interaction. You're doing vital signs. And on that unit, I was also able to learn how to place leads and all of that.
Nice.
So you have patient interactions, and then you kind of just rotate. You kind of pick where you want to be, what's your next unit. You're there for a month, you're helping the nurses, you're responding to call lights.
And we love our nurses. Nurses are everything.
Yes.
I mean, the hands-on, they're our eyes when, we're doing other things. So we really appreciate nurses. So sounds like you got a lot of good experience.
Yeah, so that was the volunteer in terms of clinical experience. I did a lot of research. I did research starting my freshman year summer, and I continued that all the way until I graduated. So in one of the experience I got to have, we did a research project that my school built. It was called the Global Women in STEM program. So we kind of learned the public health aspect. That
another commonality.
Yes, that
public
comes
health.
into that plays in medicine. So with that, we were looking at the correlation between breast cancer here in the United States and in Peru. And we kind of looked at all facets. So we were looking at diet, lifestyle, things like that. So I learned a lot of survey design. I learned how their medical system works. And then we got to actually travel to Peru.
Nice.
We got to interview some of the women. So we traveled to a small village in Cusco, and we got to interview some of the women. We got to tour some of the different hospitals. So we got to see what it was like for patients who are in a private hospital compared to patients who are in a public hospital. And a lot of these patients were getting treatment for cancer. So we got to learn about the natural remedies that they use. They kind of talked about the trust that they have in their physicians, what plays a role in how they trust their physicians. And then we also got to visit a clinic where their women's health isn't a big thing. Women aren't allowed to talk about reproduction health or anything like that, preventing STDs, things like that. So we got to visit a clinic where their main focus was educating women on preventative measures for pregnancy, STDs, all of that. So it was really nice to kind of just see the work that they were doing there.
You know what? And you touch on something that's very important, I think, before you go into medical school. I know some people just, they go down this straight path, but I think it's good to have other experiences,
Yeah.
I call myself an alternative student because I did the public health degree, and I focused on a homeless shelter, women and children. And then in medical school, too, I went to Cuba. I had the chance to go to Cuba during medical school my first year, that summer. And you're reminding me of that experience where we got to see how healthcare was distributed in a country like Cuba. And then alternative medicine, too, is very much highly esteemed in that country. So, I mean, that's awesome. It just, I think as a physician, the more well-rounded you are and exposed to cultures, that, your patients are more receptive to hearing you, and then you're more receptive to hearing them, and you guys can come to some kind of agreement on the treatment plan.
Yes.
But it's so important to understand other cultures, and the way to do that is through travel.
Yes.
So that's great. The other thing I want to talk about is challenges. I don't know if you faced any challenges on your road to becoming a doctor. There's always people that don't believe in you, or you can't do that, or why are you doing that? I mean, did you experience any of that?
Yeah, so I think for me, my sophomore year, my dad was diagnosed with prostate cancer. And I took that really, really hard. He didn't want to tell me, but he ended up having to. So I took that really hard. So then junior year, I stopped dorming on campus, and I started commuting. And that year, my dad had his surgery, so I started taking care of him. So, and during that time, I was doing research. I had a 19-unit course load. I was still volunteering. So I had a lot. So that was a challenge in trying to keep up with my coursework. So I kind of had to maneuver that. And then I also had a part-time job. So it was just trying to tell myself I can do it. It's okay. I can make it through.
Yes.
And then going into my senior year, I ended up finding out I was pregnant. So I ended up having my daughter, I want to say 3 months before I graduated.
Wow.
So during that time, I was kind of trying to figure out, I was kind of like, I'm still going to do medicine, but I was like, I do want to do the MD, PhD. Maybe I should do my PhD first. Maybe that'll be easier, and then I can go and do my MD.
Mm-hmm.
Luckily, I had a really good advisor, and she was like, honestly, I think you can go straight through medical school.
Good advice.
Yeah.
Yes.
She's like, do your master's.
Right.
Prepare for your MCAT, do all of that. But I did hear after you get your master's, maybe you should just stop, or it's gonna be hard to be a mom and pursuing medicine. And there's always this stigma around women in science where it's, you have to choose. It's either you want a family or you want your career.
And that's we're going to talk about that another day. But that is always, I think for women just in general that are trying to pursue higher education, it's like you can't have it all. You're going to sacrifice something, but I mean, you're doing it, and you have I think it helps to have a supportive partner.
I do.
You know?
I do have a very supportive partner. I have a very supportive family. I think when I found out I was pregnant, I was very scared. So I was okay, what does this mean for me? What does that mean for going forward with what I want to pursue? And I think just having that support system and them surrounding me and telling me it's okay, you can do it. And all the professors at my university were very supportive. I think at that time I was taking physics, and my physics professor, she was like, I don't want to see you back here until like a month after you give birth. Because I was like, I'm going to come back a week after. And she was like, no, I don't want to hear
that's good. She was understanding,
yeah.
right? You are a superwoman, and you did it. And, you know, despite all the obstacles, we all have obstacles. You know, you're like your dad, you know, you had your daughter, but you're still successful. How old are you, if you don't mind?
I am 24.
She's 24. And is already has a master's and going into medical school. I'm so proud of you, Janae.
Thank you.
What advice would you give to a student out there who's watching this that wants to become a doctor? Give me your top 3 things that you would tell them.
I think number 1 is to believe in your capabilities. I think a lot of things when going into this field are very discouraging. GPA, and it's MCAT, and I have to hit this mark and hit this. But I think if you just believe that you're capable of doing it, there's a way.
Yes, I say that all the time. Number 1 is belief in self.
Yes.
Okay.
I think second would be, honestly, do it the way that you want to do it. Don't think that you have to follow this structured and this rigid pathway. I think from doing my interviews and filling out my applications, I think a lot of schools want to see who you are.
That's right. So, the authentic, the real you, you know?
So I think taking that time to foster your hobbies and your passions and things like that, even if it kind of steers you outside of medicine, to kind of just show that I'm more than just
like the numbers,
more than just the numbers.
Than what you see on you know, my GPA and my classes and my volunteer work. You're like a real person because we're treating real people out there. You know? So you want to be able to relate.
Yes.
And then is there one more thing you would tell the students?
To find your support system. I think I had my family, but then I also had a friend who I did my whole medical school application journey with. Did MCAT together. We did primary applications. We did secondary applications. We did interviews together. So I think just finding your group and kind of just being able to encourage each other and have someone that's going through what you're going through.
You know what?
It's important.
You know what? And I want to give you some advice, even for medical school. You need to find I call it your tribe. Okay, and it might take a while. I know for me, I had this group. We studied together. You know, we partied together when the tests were done. We supported one another.
Yeah.
So when you go away, you know, you're going out of state, make sure you find a good supportive group. It doesn't have to be big. I think it was 3 or 4 of us, you know, and I still feel a bond with those students that I met there. You know, they're my friends now, my colleagues. I wouldn't have gotten through medical school without them.
Yeah.
So you're going to find your people. It might take a while, but you will find them. And I just want to congratulate you on all of your hard work.
Thank you.
You know, and wish you the best. We need to get you back after you complete your first year. I know you're going to be busy. I just want to see how first year is going.
Yeah.
So we'll keep up to date with Janae.
Yeah.
All right. Anything else you want to say, Janae?
No, I think that's it.
All right. Well, thank you. Congrats.
Thank you.